subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Shraddha Deshpande, and she is going to be talking to us about skin and hair care for senior citizens. A little about Dr. Deshpande. She is a consultant plastic reconstructive and aesthetic surgeon at the Wockhardt Hospitals in Mumbai. She completed her MBBS from the GS Medical, that is KEM Hospital, then completed her MS in general surgery from Karad and further pursued super-specialization in plastic surgery from Pune. To further her skills in aesthetic surgery, she underwent fellowship training at the world-renowned Instituto de Benito at Spain, and she was then selected for a one-year international fellowship at the Wellington Regional Plastic Surgery Center in New Zealand, where she enhanced her skills in skin cancer treatment, hand trauma, and advanced microsurgical techniques for head and neck cancer and breast reconstruction. Dr. Deshpande's primary interest is in aesthetics, both surgical and non-surgical, with more focus on breast surgeries and reconstructive procedures. Welcome to Health Live at Seniors Today, Dr. Deshpande.
Thank you, Maheshwari sir, for the kind introduction.
And you know, before we get into the subject of skin, but since we have somebody from a premier hospital of Mumbai here, the question is, you know, I know this is not your area of interest, but since you are at Wockhardt and, you know, even as we speak, you are in the hospital, what is the situation on the ground of COVID? Are we into the fourth wave?
We are there and still not there, somewhere in the middle. We are still not completely safe, I would say. And still the precautions need to be taken. Even if there has not been a mandatory rule regarding the masks, I think masks are something which are protecting us, and this should still be used, especially if you are in public areas, in close contact with people. Obviously, we are slowly going back towards our regular routine, and we would definitely want that to continue. But just to make sure that COVID does not put a sudden halt to that recovery process, I think if we carry out our activities even with certain protocols in place, I think we should be able to get through this.
You know, the one concern is that we heard last week, we had a doctor from Nanavati Hospital, and she was talking about the COVID ward being full. Yesterday, I heard that another hospital in South Mumbai, South Central Mumbai, not Wockhardt, but another hospital, that COVID ward was full. So clearly the numbers are increasing.
True. So we are detecting new cases every day, and the number of new cases has been on a rise. But I wouldn't say that the ICU admissions are to the extent that what we had seen in our second wave, and the transmissibility is not as much as what was seen in the third wave. So we are still somewhere in the middle, but still the precautions need to be taken. And even if somebody is planning to go for a surgery, we usually do the COVID test beforehand before we admit the patient. Yeah, so still precautions need to be in place.
And had you all stopped doing the COVID tests in between?
No, we had never stopped. Yeah. So before admission, before any surgery, we were still doing the COVID test, and we are still doing it now.
And you know, from just one last question, and I know it's not your subject, but I still want to ask you, from your understanding, is this the fourth wave, as they're calling it? Is this strain, you know, easier to handle like the third wave, like the Omicron, or is it, you know, is it perhaps tougher?
Possibly. I think we are much well equipped to handle this. Even the hospitals, the doctors, the ICU intensivists, everybody is now more prepared to catch it early, isolate people early, and treat them better. So I think the morbidity and mortality which we would see in this wave would definitely be much lesser than what was there earlier.
Thank you, Doctor, for this. And over to you and for your presentation.
Sure, sir. Should we share the screen?
Yeah, if you can share your screen. So those of, as Dr. Shraddha Deshpande is sharing her screen, those of you who have questions, please put them in the Q&A tab with your age and gender so that she could give a considered response. Over to you, Dr. Shraddha.
Thank you, sir. And welcome to one and all on this beautiful Saturday evening. Today, we are going to talk about something very basic. So it's just basic skin and hair care for seniors that we are going to talk today. So just coming to this. Yeah.
Yeah, it's fine.
Yeah, it's running. All right. So coming to why skin is so important and why it is so different as compared to the rest of our body. So skin is actually the largest organ of our body, and it is also the most dynamic organ of our body. So our skin keeps regenerating, and it keeps shedding every day. And also it keeps aging at every minute. Right from the time that we are born, our skin has started aging, and it keeps shifting according to the various intrinsic and extrinsic factors which affect our skin. So once the changes have happened in the skin, it is very difficult to reverse them. That is the reason why prevention is important. So maintenance of skin is more important rather than treatment of the skin conditions. So that is what I would want to focus on today. So how the skin changes occur? Over a period of time, with and with the aging process, the blood vessels and the sweat glands in the dermis decrease. Also, the collagen and elastin content of the skin decreases. More so in Indian skin, we see a localized overproduction of melanin, and the skin becomes thinner over a period of time and becomes more vulnerable to external aggressors, which is the irritant factors, which can be weather conditions, it can be certain harsh ingredients which are there in the soap or detergents. So our skin becomes more vulnerable as we grow older. Also, in women, especially, these changes which occur in skin are accentuated following menopause. So that is how our skin changes over a period of time. As we must have heard many times, especially in the advertisements, they say 7 signs of aging. So what are the different signs of aging which occur over the period of time in skin? So there will be fine lines and wrinkles. So these occur because of the reduction in the collagen content of the skin. Also, the elastin decreases. That is why the skin becomes more rough. Also, because of less of the sebum production or the sebaceous glands which are there, which give an oily texture to the skin. So that also decreases over a period of time, giving rise to a rough skin texture. There is uneven skin tone which happens because of localized overpigmentation. There can be dullness because of excessive dead skin which may get accumulated. Also, because of less of elastin, there will be a dilation of the pores, so visible pores. And because of sun exposure, there will be age spots and blotches on the skin and dryness of the skin. So what is important is to know what can be a regular skin routine. So even if you don't have to follow all the 7 steps, maybe around 3 steps in the morning and the night, if we follow them, we can take care of a lot of skin problems which a lot of us face. So what are these 7 steps in the regular skin routine? So the day regime would include the use of cleansers. Cleansers are usually chosen depending on the skin type. So it could be the dry skin type, combination skin type, or oily skin type. If it is a dry skin, then hyaluronic acid based or oil based cleansers are preferred. If it is oily skin type or combination skin, then usually an AHA, which is an alpha hydroxy acid or a beta hydroxy acid, which is like a salicylic acid or glycolic acid based cleansers are preferable. Toners again are uh, they can be optional. Uh, Antioxidant serum, which is commonly used and which is more commonly prescribed nowadays, is the vitamin C serum. Now, it has been found that the vitamin C serum, along with the sunscreen, act synergistically and can help in prevention of hyperpigmentation. So that is one of the things which is most commonly used nowadays for skincare as a routine. Following which an eye cream may be used, which may be used a caffeine based cream or vitamin E based creams may be used for the under eye puffiness, and followed by moisturizer and sunscreen. Now the night routine again starts with the use of cleanser with the help of toner, a regenerative eye cream which may be containing kojic acid, arbutinine, and there may be certain treatments like retinol serum which may be used. So retinol is one ingredient which actually can help in rebuilding of the skin and collagen induction, and thus thereby reducing the chances of lines and wrinkles as well as hyperpigmentation. So that is one wonder molecule which is commonly used in higher age groups, followed by a moisturizer. So whenever you are using a retinol serum, it is always advisable to use a moisturizer to prevent the dryness of skin. So what are the common skin issues that we see in, especially in seniors? So these are hyperpigmentation, most common in the Indian skin type, photoaging, dry skin and dermatitis, venous dermatitis, intertrigo, and I would also be discussing a little bit about diabetic foot, since I treat a lot of diabetic foot ulcer patients. So coming to hyperpigmentation, now that is one of the most common problems which a lot of patients face, especially Indian skin patients. And this is mostly because the skin becomes darker than the surrounding skin. And this is because of excess melanin deposition in certain areas of the body. This can occur because of excessive sun exposure, and it may also be occurring because of certain metabolic disorders like Addison's disease. So in case where the distribution of hyperpigmentation is in atypical areas which are not exposed to the sun, then it can be because of metabolic disorders. Also, there is a special type of hyperpigmentation called acanthosis nigricans, which is commonly seen in diabetic patients or in PCOS patients or in obese patients. So this type of hyperpigmentation typically occurs in the underarm areas or at the back of the neck or in the flexural creases. So to identify what is the cause of hyperpigmentation is important so that we can treat it accordingly. Also, because of certain trauma like superficial burn injury, that can also cause hyperpigmentation, which is called as a post-inflammatory hyperpigmentation. So melasma is one of the most common types of hyperpigmentation which we come across. And this is typically a patchy symmetrical discoloration seen on the face. So this is typically a butterfly shaped discoloration, and it occurs over the cheeks, forehead, the bridge of the nose, and the chin. It may be more common in women, especially in pregnant women. So it is also called as the mask of pregnancy. Many times it starts in pregnancy and then stays thereafter, and it does not decrease. This also has been seen to be accentuated by exposure to sun, and it may occur in patients who have hormonal changes, like even in PCOS, or in women who are taking oral contraceptive pills. It may also occur in relation with thyroid deficiency or vitamin B12 deficiencies. So how do we treat melasma? So important thing to be known about melasma is that it cannot be cured completely. It can only be controlled. So once it has started, it is important to diagnose it and start treatment immediately. If the problem is some hormonal issue, then that needs to be treated first. If it is uncontrolled diabetes, or if it is obesity, or if it is PCOS, that need to be treated first. Following which, sun protection again is extremely important. So the use of sunscreens should start right from childhood, right from your teenage, when you're playing outside. That is the time when use of sunscreen should start. So initially, it can be physical sunscreens, which are containing zinc oxide or titanium dioxide. If it is a sensitive skin, then again, physical sunscreens are better preferred. Along with sun protection, if the melasma has already started, then certain skin lightening creams are usually prescribed, which contain ingredients like hydroquinone, retinoid, azelaic acid, kojic acid, etc. Again, as I mentioned earlier, vitamin C serum is acting synergistically along with sun protection. So that is commonly used for treatment of melasma. If it is a severe degree, then we have to do certain treatments like chemical peels, microneedling, lasers, commonly Q-switch lasers, and tranexamic acid. Coming to another common issue which a lot of us face as we age is photoaging. So photoaging is basically aging which occurs because of chronic exposure to sunlight. Excuse me. So photoaging is aging which occurs due to chronic exposure to sunlight, or it can also occur because of exposure to artificial sources of UV light. For example, screens, even the laptop screens or the mobile phone screens, that can also cause photoaging. And this is most commonly seen on the visible parts of the body, like the face, neck, and the back of the hand. Even lips are not spared, so lips can also show signs of excessive sun damage. So the signs which may be seen because of photoaging include pigmented spots, freckles, solar lentigens, also called as age or liver spots, which must be seen like those red color spots which we see on the skin, or even skin tags, and uneven skin color, uneven skin tone. Over a period of time, there can be wrinkles around the eyes and the mouth, and a formation of deep creases and forehead frown lines. There can also be some rough scaly spots which are called as actinic keratosis, which may occur. So I just want to highlight this picture. This was one person in Canada who was around 70-year-old, and he was a truck driver, and he traveled along the highway all throughout his life with just the left side of his face exposed to the sun. So we can see that the chronic exposure to the sun has caused such a difference over his face. So that is one of the signs of photoaging, which I would want to highlight in this case. So how do we treat photoaging? Again, prevention is better than cure. So sun protection is extremely important. Certain topical retinoids, the use of retinol serum, also certain retinol-based creams may be used for treatment in cases of photoaging. Antioxidant supplementation. So we usually prescribe certain nutrient supplements which may be containing antioxidants like glutathione, and also definitely use of certain ingredients like flax seeds and nuts can actually supplement the antioxidants with the help of diet in prevention of photoaging. Certain treatments are used for photoaging like chemical peels, lasers, which are commonly the CO2 lasers or the Q-switch lasers. Then certain treatments like microneedling, radiofrequency are used for decreasing the visible pores and collagen induction. Fillers and Botox are again certain treatment modalities which we use for reversing the signs of aging. So Botox is basically a neurotoxin which we inject in the facial muscles, and it causes relaxation of the muscles. And it is more so a preventive measure for prevention of lines and wrinkles. Also, there are a lot of misconceptions regarding Botox, that it may cause a frozen face and everything. But truly, if it is done in the correct way, it can actually uh, uh, give a very youthful appearance to the face. Fillers, again, there is a difference between Botox and fillers. So fillers are actually neutral substances which are used especially in places where there are hollows, like the laugh lines or the under eyes where there is hollowing. And usually uh, they can be done as a lunchtime procedure. And it is used for places where there is loss of volume because of aging. But again, fillers and Botox are temporary procedures, and if they are done once, they may have to be repeated every 6 months or after 1.5 years. So we as plastic surgeons, we use certain techniques like nanofat grafting, which is also augmented with stem cell therapy. So in this case, what we do is we actually extract fat from the patient themselves. So fat is extracted and it is centrifuged. This is extracted through small cannulae, and it is centrifuged. This fat is then uh, filtered, and only the fat which is broken down into nanoparticles is then injected just under the skin. So this causes two things. One is it restores the volume which is lost from the face. And also, since it has stem cell properties, it causes collagen induction. So that is one of the newer techniques which we are nowadays using for facial rejuvenation. Obviously, when the minimally surgical techniques are not helpful, then the last resort for improvement is facelift. Also, commonly we see that a lot of people face dark circles, and it can be commonly seen in the elderly age group. So this can happen because of lack of sleep or poor sleeping habits. It can occur because of reduced levels of fatty tissue around the eyes, thinning of skin around the eyes, deficiency of iron, overexposure to sunlight, smoking, it can be genetic, and it can occur because of thyroid as well. So how do we treat dark circles? The treatment would depend on the cause of dark circles. So commonly we give topical applications which may contain vitamin C serum or certain ingredients like azelaic acid, kojic acid, hydroxyquinone, and retinoic acid based creams. If it is more so because of hollowing under the eyes, then usually we use fillers or nanofat grafting to mask the hollowing. If it is more of pigmentation, then certain chemical peels also may be helpful for improvement of the dark circles. And if there is a lot of wrinkling under the skin, then we use a surgical technique called as lower lid blepharoplasty or eyelid lift procedure, in which we remove the excess skin and fatty tissue which is there under the eyes, which is causing the bulging of the eyes. Coming to another very common problem, and it has been accentuated more so during the COVID times, is the incidence of dry skin and dermatitis. So this has been seen commonly because of, again, loss of collagen and elastin in the skin as we grow older, and the thinning of skin and less of sweat glands. So this makes the skin more vulnerable to the external irritant factors. So the irritant factors can be the elastic of the mask. It can be even the clothes that we are wearing. So if you're wearing synthetic clothes, that can cause irritation. If it is detergents, you're washing your hands, or you're using sanitizers again and again, that can be an irritant. It can be the washing soap. So if you're washing utensils, that can be an irritant, or the detergents you're washing your clothes, that can cause irritation. So that is one of the things which we need to be aware of, that what is the irritant factor. Dermatitis typically is a rash which occurs on the skin along with blisters. Sometimes when there is a breakage in the skin barrier, it can also lead to infections, and the infection causes folliculitis. So this actually looks like an acne breakout, and it can actually accentuate and cause an entire skin and subcutaneous tissue infection, which is a cellulitis. So how do we treat dermatitis? First important thing is to remove the irritant, identify and remove the irritant. Also, over a period of time, the skin becomes vulnerable to extreme heat and cold. So it is important to protect our skin from extreme heat and cold, and to use gloves or to use mittens, or use socks whenever you're going out. So those things need to be taken care of. Also, emollients are extremely important. As there is dry skin, appropriate emollient may be used. So these can be ointments which are oil-based, creams which is more of oil with water, and lotions are more of water-based. So depending on how your skin is, you need to use a proper ointment, cream, or lotion. If it is more irritant and causing more dermatitis, then certain topical steroids may have to be added for the treatment. And for extreme cases, we may have to take certain oral medications or certain immunosuppressants as well. So certain skincare tips which everybody can use to prevent this dermatitis is drinking a lot of water, and to eat food which is rich in antioxidants to help and retain the moisture of the skin. So this can be blueberries, oranges, sweet potatoes. If you're having non-veg food, then fish is actually a very good ingredient for antioxidants. Use gentle skincare products. So everybody cannot be using the same skincare product, and it has to be according to your skin type. So especially for dry skin or for sensitive skin, you should use gentle skincare products, and moisturizer is essential. So after cleansing, it is important to moisturize your skin. Also, limit your bath time to about 10 minutes and avoid very hot showers and harsh drying soap. So a lot of soaps which we use, like Santoor or Pears, a lot of them are actually quite alkaline soaps. So using slightly neutral soaps are actually more helpful to prevent dry skin. Also, even immediately after bathing, it is good that if you apply a moisturizer, so that actually locks the moisture in the skin and can be more helpful in preventing dry skin and dermatitis. Look for certain hydrating ingredients like glycerine, mineral oil, or dimethicone in your moisturizer. So that can actually maintain the skin's moisture barrier. Also, if required, this is not for Mumbai, that a humidifier may be used to prevent lack of moisture. But yeah, even in places where you use air conditioners, I have seen that that has caused a lot of skin issues. So you need to make sure that your air conditioner is not drying your skin out, or you're not using an overnight air conditioner, or maybe using a moisturizer before you're going to sleep. Certain fabrics like cotton are actually kind to your skin, so preferably wear cotton clothes. Wearing a sunscreen can actually help in a long way, and refraining from smoking and alcohol can have a really good effect on the skin. So coming to certain other skin conditions, which as plastic surgeons, we commonly see, is something called as venous dermatitis. So this occurs because of stasis of the venous blood in the leg veins. So as we know that gravity keeps acting on our body, and this actually causes and periods of long standing, and especially in an older age group, there is a lot of stasis of the venous blood in the leg veins. And this causes a leakage of hemosiderin pigment in the skin. And also because of the raised interstitial pressure in the skin, there is a lot of swelling. There can be irritation because of the pigment, which will cause darkening of the skin. It may cause itching and swelling, and if it is staying for a longer time, then it can finally cause ulcerations, which are called as venous ulcerations. So how do we treat them? Obviously, prevention is better than cure. So once you start noticing that there is a dilatation of the veins, which are seen in the lower parts of the leg, it is important to start using stockings. So you can get grade 1 pressure stockings for early venous stasis, and use of emollients is important. So if there is irritation of skin which is happening, moisturization is very important. If there is already venous varicose veins which are set in, then leg elevation is important. So using a pillow under your leg while you're sleeping, or raising the lower part of your bed, that can actually help in prevention of venous stasis or venous dermatitis in a longer time duration. Once it is already set in, there is swelling which you can see, then using a 4-layer bandaging or compression is important. And if there is an ulceration which is already formed, then growth factor concentrate is one of the things which we use commonly in Wockhardt Hospital. I'll be talking more about that. So again, diabetic foot ulcers are also common. As we know that diabetes is so common, and it is another silent pandemic that it is occurring simultaneously. So knowing about diabetic foot is also essential. What happens in diabetes is there is a triple effect on the foot. So this happens because of neuropathy, which is the affection of the nerves. It is because of limited joint mobility, and as well as there is ischemia of the foot. So the diabetes affects even the blood vessels, which causes the microangiopathy, less blood supply to the foot, neuropathy, and limited joint mobility. So this causes the foot to be vulnerable to the various pressures, to the trauma which we undergo. We walk so much and we take our feet for granted at times. So then there can be certain things which actually get hidden, they get masked off, and then they present in the worst stage. So identifying issues like corns and calluses, and diagnosing that, okay, your foot is vulnerable to developing a diabetic foot ulcer is important. So usually we would want patients to be identified right at the stage 1 or stage 2, before the infection goes into the bones and tendons, and step 4 is gangrene, the stage 4. So before the stage 3, stage 2, if stage 4, if we identify the patients right in the first or second stage, then we can treat them with non-surgical techniques also. So what are the treatment modalities? First is to keep the foot clean. Important is to teach foot hygiene, to maintain the health of the skin over the foot, teach foot hygiene, and maintain the good nails. Check if there is any bony deformity, if there is already an ulcer which is formed, getting a foot x-ray done, identifying the pressure points, and offloading the foot. So these are a typical offloading devices that we commonly prescribe if there is a diabetic foot ulcer which is already formed. If there is a wound, then giving an optimum environment for the wound to heal, an infection-free environment. And if there is an ulcer which is formed, Then we use growth factor concentrate for treating such ulcers, which have healed beautifully, as we can see here. And obviously, strict diabetic control is also very important for diabetic foot care. So coming to the second part of our discussion today is about hair care and why hair loss occurs and how can we treat it and prevent it. So hair loss is just a part of our aging process, but in certain patients it occurs early. So this is because of the genetics, and it is called as androgenic hair loss. Also, there are certain medical conditions like alopecia areata, which was recently highlighted quite a bit. This commonly occurs in form of patches, and it is because of the immune system. Then also there are certain stressors like cancers, childbirth. Then certain hair treatments can also actually cause hair loss, like perming, coloring, or straightening. Certain hairstyles like tightly tying your hair or braiding your hair, actually that is also called as a traction alopecia because of the pulling of the hair in hairstyles. Then certain hormonal imbalances, nutritional deficiencies, thyroid conditions. So these are some of the commonest causes of why hair loss occurs. So another thing which I would want to highlight with this slide is that we know about androgenic hair loss in males, and there is a pattern hair loss which is seen according to the Norwood scale. But hair loss can also occur androgenically in women, and there is a pattern hair loss which occurs. So this needs to be identified early, and we can treat it with certain non-surgical ways as well. So how do we diagnose it? We do a scalp analysis in which we identify if there is a patchy hair loss, or if it is concentrated in certain areas like the frontal area or the vertex area or the temporal areas. We do a pull test to know if there is a root instability or if it is a fragility of the shaft. Then certain blood investigations may need to be done to identify if there is thyroid or vitamin D, B12, or vitamin D deficiency and protein deficiencies. In certain conditions, we may have to do a scalp biopsy to know if it is any autoimmune condition which may be causing the hair loss. And trichoscopy is a microscopic examination of the scalp. So the most common treatment modalities which we use for hair loss are a triple combination with nutrients. Nutrient therapy is nutritional supplements like biotin, zinc, folic acid, vitamin B, B12, D, and proteins with vitamin C. Certain oral medications like finasteride, spironolactone, and topical applications which are commonly used are minoxidil and finasteride. Also, there are certain modalities which we commonly use. So one of them is growth factor injections. So as we can see, then laser light therapy, microneedling, and hair transplant. The last modality is obviously hair transplant. So what is growth factor treatment? In this, it is something which is autogenous in that we actually collect blood from the patient themselves, and about 30 to 60 ml of blood is collected. This blood is then centrifuged, and then it separates into 3 layers. So that is the RBC layer, this is the buffy coat layer, and this is the platelet-rich plasma layer, which is a seen. So this plasma is then extracted, and certain growth factors like the epidermal growth factor and the platelet-derived growth factors, they are activated in this platelet-rich plasma. So that's why it is called as a growth factor concentrate. And then this plasma is then injected directly into the scalp. It acts like a fertilizer for your hair follicle and decreases the telogen phase, which is the shedding phase, and increases the anagen phase of your hair. And that is the reason how it improves the texture and the uh, uh, viability of your hair. So usually about 3 to 5 sessions of growth factor concentrated injections are done at an interval of 1 month each. And that is one of the non-surgical ways in which we can improve the condition of our hair. So when there is absolutely no hair follicle in certain areas of our uh, scalp, then the only treatment modality left is a hair transplant. So in hair transplant, we actually remove follicles from the permanent zone of the hair, which is called as the donor area, and then we transplant it into the recipient area, which may be the crown area or the vertex area. So this technique is based on the concept of redistribution of hair to achieve cosmetic density. And this density can never be same as the natural density, but cosmetically it looks similar. And there can be two techniques which may be used. That is the FUE, which is the unit extraction technique, and the unit transplantation, in which we actually remove a strip of skin and then use the hair follicles for transplantation. So coming to what are the regular hair care tips which we can follow in our daily routine for maintaining your hair health is, again, just like skin, we shouldn't be using very hot water for washing our hair, because that can again make our hair fragile. Use of sulfate-free shampoos. Again, sulfates are commonly seen in certain shampoos like Head and Shoulders or L'Oreal. Most of the shampoos which we use are actually containing sulfates. So they are good, but they may, if you're using it more fragile. So if you are using a shampoo quite often, every day or alternate day, then it is better to use a sulfate-free shampoo and to use a conditioner whenever you are using a shampoo. Usually after washing your hair, it is better to avoid combing through the wet hair, or a white tooth comb, or detangle your hair with your hand, because that is the time when your hair is most fragile. Also, it is important to wash your hair thoroughly to remove any soap residue. So usually if it is preferable, if you are in a hurry in the morning, it is preferable to wash your hair in the evening, or maybe just wash it once or twice in a week. But whenever you're washing your hair, wash it properly, thoroughly, to remove any soap residue. Also, coconut oil has been proven to be actually good for conditioning of hair. So it is advisable to use it more on the hair shafts rather than the scalp itself, because that can actually be difficult to wash off, and then the remnant can actually attract more dirt and grime, and then again cause dermatitis. So it is advisable to use the oil on the hair shafts itself rather than the scalp. And also avoid too many hair treatments like coloring, straightening, or perming of hair. So coming to the final message which I would like to put forward is that skin and hair are actually quite dynamic, and they require regular maintenance and care. What we eat is what we are. So nutritional deficiencies are the number one cause of hair and skin issues. So that is something which we need to look after more so, rather than taking supplements for making sure that your hair and skin is fine. Also, overwashing of skin and hair can remove the lipid barrier and cause more harm. So it is better not to overwash your skin or hair. And prevention is better than cure. So use of sun protection and regular skin routine, as well as having a proper sleep cycle, can actually go in a long way to avoid skin and hair problems in the future. Thank you so much. Yeah. And
Thank you.
questions are welcome. Yeah.
Thank you very much, Dr. Deshpande, for this presentation. A very detailed one. And I think most questions have been addressed over here. I know you were, there were some parts where you were, you needed to clear your throat. So in case you want to do that, you could do that. And
No, I'm good now. I'm good.
these things happen. Yeah, the questions are there. There's from Sham Mittal, who asks how to minimize scar marks left at the backside of the neck of my wife, who's 71, after a recent herpes zoster virus attack has been treated.
Okay. So how recent was that? Maybe if it is within the 6 months or so, then there are certain scar reducing creams which can actually help. So these scar reducing creams are commonly silicone based creams. So they can actually help with reduction of scars. Another important thing is to use a moisturizer and massaging that area. So that can also help in reduction of the scars and the irritation which is caused by the scars. So massaging with an emollient and use of certain silicone based creams, they can help in reduction of scars.
Right. We have a question from Sudhir Srivastav, who asks, does the functioning of the sweat glands decrease over time and can they be revived?
Yes, the functioning of the sweat glands definitely decreases over a period of time. And it is just a process, the normal aging process. So we cannot be, and this is actually more accentuated in diabetic patients in which there is an autonomic neuropathy. So this is a mechanism of our sympathetic and parasympathetic systems. So when the sympathetic and sympathetic systems start decreasing, that is the time when the sweating and the sebaceous gland secretion decreases. So there is no way in which we can augment it, but we can start using certain emollients, as I explained, like moisturizers need to be incorporated in your daily skin routine. Something which you were not probably using before the age of 30 or 40, you may have to start using when you start noticing that your skin is becoming more irritable, more dry. That is something which you will have to use as on a regular basis. And obviously, dietary ways in which we can improve is use of certain antioxidants and nuts, flax seeds into your diet. So incorporating certain healthy fatty food in your diet can actually help in maintaining the lipid barrier on your skin.
Thank you. There's a question about moisturizing cream. Is Cetaphil moisturizing cream a good option to look at, or should one just look at any moisturizing cream?
Yes, definitely. Cetaphil is one of the commonly prescribed moisturizing creams, and especially for sensitive skin or dry skin, it is one of the most commonly prescribed moisturizing creams. I would definitely endorse that. And what was the second question?
No, just that question. The next question is, you already answered that about hair coloring, about the damage to the skin. Now, the earlier question that Mr. Shrikant Kulkarni, who's 71, asks, fingers and forehand skin get cracked whenever one washes clothes or dishes, perhaps due to detergents. Can this problem be overcome without giving up washing?
Yes. So if that is being seen regularly, then definitely your hand is getting irritated because of the dump. So what we can do is change the detergent, which may be causing it, or use of gloves when you are washing your utensils. So there are definitely certain gloves which you get, which we can use when you are washing your utensils. Another thing that you can do is just before washing your utensils, put a generous layer of moisturizer on your hand. So that will actually protect your hand from directly getting in contact with the detergent. So these are some things which can help.
But practically it's a little difficult, right? If you moisturize your hands with cream, and then if you're going to wash the utensils, you don't want the cream to, stick to the utensils, right? Or the dishes, whatever you do.
Not really. They don't really stick to the utensils. They will protect your skin. They will remain on your skin. You can use coconut oil if that is being of concern.
I'm going to try doing that today. Okay, Mr. Brish Duggal, he is 78. He wants to know how to remove warts on the face.
Yeah. So usually what we do is we use a radio frequency cautery. So it is an OPD based procedure in which we use a device which has a small needle, and that actually can just remove the warts. So these are just usually, and we do apply numbing cream before we do that. So that is one way in which we can do. Also, there are certain uh, uh, creams which we can just apply, and they allow the warts to fall off, but that takes a longer period and sometimes that causes irritation of the skin. So we prefer to use an RF cautery for removing warts.
There's an interesting question from Dr. Sham Mahajan. He asks, is hair needed for human head except for looks?
Very good question. Not really. There are so many people who look absolutely wonderful without hair. So that is, yeah, that is definitely, and we can obviously wear caps and everything if you want to go out in sun and protect your head. So hair is just a part of our beautification process, I would say. It's not an essential part of our body.
There's a question from an anonymous attendee who asked, the cherry spots on my skin keep increasing. The cherry spots on my skin.
Cherry spots on your skin.
And they keep growing. Do they burst? What can be done to avoid them? This person's
and
age
they burst. There is a bleeding also which happens after that. Possibly. That is what
age
remains.
Is 59.
Yeah. Yes. So that is one of the very common things which we also observe. So this happens because of the changes in skin occurring because of exposure to sunlight. So we advise to prevent that in future to use a sunscreen. And if it is already occurring and if it is, especially when you're shaving and it starts bleeding at that time, then we remove that particular spot with the help of RF cautery.
Right. We have a question from Marjorie Fernandez saying, my skin gets very dry only in the Delhi winters. It's okay in the summer. I use hand cream to overcome this problem. Can there be any other way to deal with this issue?
So the skin becomes dry, especially in the hands, right? Yeah. So this is very common problem which we come across. So the only way to tackle it is to avoid going in extreme heat and cold. Use of gloves whenever you are going in extreme cold, and whenever you, after taking a bath, immediately after taking a bath, put a generous layer of thick moisturizer. Many times you have to use a different moisturizer for winters and summers. So there are certain moisturizers which are more water based, which can be used in summers, and a little thicker moisturizers may have to be used in winters, and especially if they contain dimethicone or shea butter. So certain ingredients may have to be looked for when you're using moisturizers for summer. So if you're taking care in that way, you can definitely prevent. Obviously, there are certain patients who have extreme cracking of skin, peeling of skin. So in those cases, we even have to prescribe certain topical steroid creams also.
Thank you. There are three questions from Pushpa Shah. I'll ask two of them. Is it better to use medicated sunscreen or a regular one if no skin issues are there?
Yeah. So you can use your regular sunscreens. Just make sure that the sun protection factor is more than 30.
Right. The other question is something that you've spoken about, but I guess you wanted to precise. Does hair coloring cause cancer in the long run? What is your view?
Yeah, so there have been certain hair colors in the past which have been proven to be cancerogenic. So they have already been banned. So usually now the colors which are being used are safe, and usually look for a brand which is widespread, which is used commonly, and which is ammonia free, which is parabens free. That will be safe, definitely. If you are using for some local brand which has not been uh, tested enough, that may have certain ingredients which may be cancerogenic.
Doctor, two questions on hair care. One is that I don't use any shampoo for my hair. I wash my hair every day. I'm a male, 63. Is it okay to just wash your hair with the regular bathing soap?
If he is not facing any issues, then it's absolutely fine.
Right. There's a question from Chinmay Shah about an opinion of a certain brand name of a shampoo. I don't think we should take that. There's one last question from Marjorie Fernandez. I have some sort of fungus which makes it difficult to cut some of my toenails, as the nail seems to keep getting attached to the skin below. How does one deal with this situation?
Sorry, I didn't get that.
She says, I have some sort of fungus which makes it difficult to cut some of my toenails, as the nails seem to be getting attached to the skin below. How can one deal with this situation?
Yes, so again, a lot of seniors have chronic fungal infections, especially for the toenails. And this causes a lot of toe deformity, which becomes very difficult to correct. So in those cases, it is important to make sure that you identify somebody who is helping you with cutting of the toenails in a very appropriate manner, that you don't cut off any part of the skin. And apart from that, if there is an active fungal infection, then we can still treat it with certain antifungal medications, which may have to be taken for a longer period of time.
Doctor, there are quite a few questions that have come in. Just clearly indicates that there are the number of people who want information on this issue are so many. But before we continue, Doctor, first of all, thank you for being here. And I just need to make a few announcements. Those of you who are regulars at our events can, we would like to know what you think about our programs. And in the chat window, we are putting a link to a form, a survey that you can perhaps take. It will just help us understand what you are interested in, so that we can plan out the schedule very well. Doctor, just for your information, other than Health Live at Seniors Today, which we do on Saturdays at 5 p.m., there is also the Seniors Have Talent, which is a singing contest, singing talent hunt for people who are 60 years and above. And we are now going to start our 8th season from August 17th. So 8th season, which means we've had over 500 participants already and around 140, 150 winners in these things. This is only for people who are above 60. I didn't think it will last for more than 2 seasons. But, 8th season, we are already, quarter full with selections. And we have selections. We don't take some people, etc., etc. So in case you know anybody,
that's amazing,
who's into singing, there are some people who are there, who are attendees over here. So that's there. One of the things that is happening, and I must tell all of you here, is that because life is back to normal in a sense. Of course, life is getting back to abnormal as I see it. But there are days when we are not able to, like for instance, I must tell you that Dr. Shraddha was almost not going to be able to make it because there was an important procedure that was there. Thankfully for us, it got pushed to tomorrow. But there are days like these. So sometimes our announcements come in late. So those of you who would like to pre-register for our health webinars, you can do that by, once again, the chat window will have a form which you can fill up, and we will register you for all the sessions, forthcoming sessions of the health webinar. Some of you have already done that, but this is because this is a reality. We do face situations where doctors aren't able to make it because life is getting back to normal or abnormal. There are OPDs to look at, etc., etc. So thank you very much, Dr. Deshpande. Again, it's past 6 o'clock. We've been here for over an hour almost now, but very enriching session. And I think your presentation was very detailed and it spoke a lot. And there's one question which has come in. I must ask you about: is there a hair transplant facility at Wockhardt Hospital?
Yes, we do have it. Yeah.
Right. Great. Thank you very much, and thank you to the Wockhardt team for facilitating this. And have a good weekend. I know you're going to be working tomorrow, but have a good weekend, Dr. Deshpande.
Have a good weekend, everybody.
Yeah. Thank you. And we will be back once again next Saturday. That is the 25th of June at 5 p.m. for another session of Health Live at Seniors Today. Thank you.
Subscribe now and press the bell icon. Never miss an update.